looking at this, attending this webinar, this technical discussion that we're sure will be very useful and helpful for the work that you do. So please go ahead and either use the QR code or go to the menti.com webpage, enter the code, and tell us where you are joining us from. We want to see that map populated. And we will give a couple of more minutes before we start so we can allow other people to join us today. Thank you. A lot of people join us from different parts of the world, which is really great. From North America, Central America, I'm in South America, and of course, Africa, Asia. From Tonga, wow. Guyana, Pakistan, Afghanistan, Lebanon, Sierra Leone, my goodness, and Syria, of course, Nigeria, Kenya. So we will have colleagues joining Omar and Isaiah from Syria and Kenya, which is great. So thank you again. Thank you so much for joining us today, and we look forward to your participation in this very important webinar. So we'll get started now. Thank you again, and welcome everyone. Today, we're going to be talking about a very important topic, which is how to protect the quality of the products by implementing good warehousing practices and handling practices in emergency settings, which is relevant for all the work that you do, especially at the last mile. So I'm joined by my colleague Annabella today, and together we will facilitate this session. And so, Annabella, can you please introduce yourself?
Yes, thank you, Nora. Good morning and good afternoon, everybody. Welcome. And I am Annabella Sanchez. I am based in Guatemala, although in the map seems that I am in the Pacific Ocean. But I have been working in supply chain management for many years now in Latin America and some countries in Africa. I have also supported family planning and health advocacy, health system strengthening as well. So I'm very happy to be with you this afternoon.
Thank you, Annabella. And I'm Nora Quesada. I'm a senior technical advisor at JSI, working in supply chain management for 30 plus years now in different areas of supply chain, reproductive health, and system strengthening and health insurance schemes in several countries in Latin America, Eastern Europe, and Africa. And I'm very happy to be part of this discussion today. And we are very happy to have with us two very important guest speakers from the field who will share their experiences in how to implement good warehousing practices and handling practices in emergency settings. So we will have Isaiah Nyamosi. So Isaiah, can you please introduce yourself?
Thank you, Nora and Annabella, for this opportunity. Yes, my name, good afternoon, good morning, wherever you are. My name is Isaiah Nyamosi. I'm a pharmacy manager in the IRC Kenya Country Program. As you can see in the introduction, I have quite an experience in both the hospital and community pharmacy, as well as in the humanitarian environment, where I am in charge of pharmaceutical logistics and supply chain, basically. And I'm here today to take you through best practices in warehousing. Thank you and welcome.
Thank you so much, Isaiah. Thank you for your time, and we are very excited to hear more about what you are going to share with us today. And our second speaker is Omar Ali. He comes from Syria. So Omar, can you please introduce yourself?
Yes, thank you, Nora. Thank you, Annabella. Hello, all, and thanks for giving me this opportunity to be a part of this technical discussion session. My name is Omar Muhammad Ali. I'm a pharmacist. I'm working as a pharmaceutical management officer with IRC since more than 6 years. I'm responsible for ordering, receiving, inventory, and control, and distribution and monitoring, and also evaluation of health commodities. Thank you.
Thank you, Omar. Thank you for joining us today. And again, as I mentioned before, we're very excited to have you and look forward to hearing more about what you are going to share with us today. But before we start, Annabella will give us some housekeeping recommendations for today's discussion so that the session runs smoothly. So the floor is yours, Annabella.
Thank you, Nora. To begin, we would like to remind you that there is a chat function to continue introducing to one another. And for the questions that you would like to ask, please make sure that you use the Q&A button instead, so that we keep track of all your comments and questions in a better way, okay? We also would like to thank the USAID Bureau for Humanitarian Assistance because through this project, we are able to develop curriculum for training participants of the blended learning courses. We know that some of you are present today in this meeting, so that is one of the activities. Also conduct other capacity building and sharing learning experiences like the one we're doing today, and support partners in institutionalizing and improving pharmaceutical management practices. Also, another important reminder is that this event and other events coming up in the next months are part of this education series. And if you attend 4 or more of them, you will get a certificate at the end of the year. So stay tuned and try to join us during the rest of the meetings with important topics. Also, the session objectives of today, and knowing that warehousing is a fundamental and a pillar of the supply chain management system, we're going to review key aspects of effective warehousing of pharmaceutical and health supplies. We're also going to share examples through Omar and Isaiah about good warehousing and handling practices, especially in dire conditions, in complex conditions when an acute phase or a crisis arrives. And the third objective is to learn about the challenges and solutions, those that will be shared by Isaiah and Omar, but also from the audience as well. As I said, warehousing is such a cornerstone to the supply chain and the logistics cycle. And there are several activities every one of them very important. And we are not going to go in depth, but just to show on the screen, infrastructure is key, the location of the infrastructure, where is the warehousing, warehouse facilities will be identified and located. Consider everything that GDP's guidance say about the layout and the operations of the warehouse inside and outside of the warehouse. Also, budgeting and making sure that you have all the warehouse equipment that will facilitate the not only the storage, but also the handling of the products, including special storage that psychotropic medicine and expired products. Another key aspect related to warehouse, it's inventory management. That tells you, and it's related to the warehouse capacity. According to demand, will you need to expand the warehouse or include other warehouses in your network? And I would also like to highlight the last two, security and safety, and like the saying below says, safety isn't expensive. Safety is priceless. And safety is also a matter of motivating all the important warehouse staff that take care of the warehouse. If they are safe and all the products are safe, they're going to be motivated. And the human resources, of course, they are fundamental to the work in the warehouse, but they are very important through all the supply chain management. So in the humanitarian space, we need to talk about warehousing, but also identify ourselves depending on the phase of the humanitarian response. For example, preparedness, acute phase, protracted, and post-crisis. So here in the next screen, you will see some of the ideas that we think that are important, but I'm pretty sure you have others. And if you have others, please write them in the chat while we are in the meeting. In the preparedness phase, as other aspects of supply chain management, review standard operating procedures, develop some job aids if you don't have them, train supply chain management staff continuously, pharmacists, warehouse managers, and everybody that is part of these important teams in warehouse. Then during the acute phase, when things get complicated and you wonder, am I going to protect the quality and the integrity of the products if there is a tornado? So you need to activate all the emergency network protocols that you have, participate in logistic clusters so that everybody knows what is the warehousing capacity, if it has been damaged, etc. And also carefully manage the risk of the staff. That is very important. And strengthen inventory visibility and the transactions of all the movements of the warehouse. Then the protracted phase, transition from kits to individual items. That is a very common action that sometimes you ask questions about. So that is important to consider during the protracted phase. And at the end of the crisis, when things are more or less going back to normal, incorporate lessons learned. Review again the policies and improve your processes. So with that summary, I will pass the floor back to Nora.
Well, thank you, Annabella, and thank you for setting the stage for the conversation today. Very useful background information and good suggestions to take into consideration when we're thinking about good warehousing and how to protect the quality of the products to the last mile. But before we start this conversation, we have one question for the audience, and that you can respond it by using the Menti again. The question is, what is your greatest challenge to maintaining good warehousing conditions? You can also respond in the chat if you want. But just think about what is your major challenge to really keep good warehousing conditions. We will take like a minute for you to respond.
And to populate the question, the question, you can use the code 73472197.
Yeah, you can see the code at the top of the screen on the slide. Okay, you're saying insufficient capacity, staff turnover, lack of resources. Okay. Okay, keep going. Okay, financial commitments, accurate, skilled staff. We believe lack of skilled staff, inadequate storage space, real-time reports, manpower, which is related to what Annabella was saying about the human resources. Yeah, a lot of comments regarding around human resources, having the skills, having the training, also having access to SOPs and so on. So thank you so much. So during today's presentation, we will be talking about some of the things that make a good warehousing, that make a good practice in warehousing, and how Syria and Kenya, but at a global level as well, in the case of Isaiah, are strengthening the capacity of people, as well as the implementing the good practices in warehousing and handling in emergency settings. So we will start our discussion now with Omar. And Omar, before we start, we know that you work at IRC in Syria. So can you please give us a brief introduction of what IRC does in Syria in humanitarian assistance? So the floor is yours, Omar.
Thank you so much, Nora. Thank you again, and hello all for IRC Syria. The work about IRC started the work in Northeast Syria in 2014 after Sinjar and Iraq crisis, after the assessment with 3 medical mobile units to provide primary healthcare services as a response to Sinjar Iraq crisis, gradually increasing primary healthcare intervention to other areas in 3 governorates. In 2022, IRC Health Program manages 22 health facilities and provides primary and secondary health services with donor funding. We have 8 MMUs distributed between 4 locations. It's Al-Hasaka Governorate, Derik, Raqqa, and Deir ez-Zor. IRC has more than 300 health staff that includes doctors, pharmacists, nurses, midwives, and community health workers and other staff. Next slide, please. For distribution of health facilities in Northeast Syria, we have 24 health facilities, 18 direct and 6 through partners, distributed between, as I mentioned, between 4 locations or 3 governorates. It's Hasaka, Deir ez-Zor, Raqqa, and Derik. Next slide, please. For distribution of pharma warehouses, we have in Northeast Syria, we have 3 pharma warehouses. There's Al-Hasaka, Derik, and Al-Raqqa. For Al-Hasaka, this is central location for all regions, support all locations as needed. We have good location and good conditions with 3 energy sources, especially for cold chain. For Derek Pharma warehouse, this is a very important warehouse because it is close to the border with big storage and good capacity. This is central warehouse for transit area and temporary storage area at night time for security reasons. And also we have contingency stock for use in different locations under different grants. The last one is a Raqqa Pharma warehouse. This small warehouse with a limited capacity to support health facilities with 3 months of stock. Next slide, please. This is the map. Syria, Northeast Syria. As you see, we have 3 pharma warehouses highlighted in red, and in blue it is health facilities. As you see, Derek Pharma warehouse is close to Iraq border, and Hasaka Pharma warehouse, it's a central location for all regions, Derek, Raqqa, Deir ez-Zor. Over to you, Noura.
Okay, great, Omar. So it seems like all these warehouses are strategically distributed in that region so that you can ensure the availability of the products given the different situations that you may face, right? So in your experience, what are the key aspects like processes, resources, staff that can ensure good warehousing and storage conditions and practices, in addition to what you just shared with us about specializing each of the warehouses depending on the situation?
Yes, Noura. What about key IRC working through a committee? We have committee, pharma and supply chain and the health team that are responsible for ordering, receiving and inventory and releasing commodities. And this is to avoid any kind of shortage, overstock, stockouts, and assess storage space for commodities. This is for ordering. What about receiving an inventory? The same committee will follow up for checking item by item, monitoring transportation process, time and conditions, performing quality control, opening all cartons and checking the quality, packaging, batch number, expiring date, storage conditions, managing the inventory, and verifying the quantities are according to the packing list and the order requested, and the pharma inventory tools, PIT, and last one it is checklist. The last one is releasing commodities. The same committee will follow up this step also after receiving weekly or monthly or sometimes emergency request. We are preparing the quantities to issue to health facilities and follow up the distribution process to the last mile. Next slide, please. What about standard using standard tools or SOPs for IRC? We have cold chain SOPs modified and adapted by IRC Pharma team, and we have also daily and monthly consumption, psychotropic register. We have daily log, which include releasing, received, damaged, expired, inventory, etc. And also we have tracer of medicines. This tracer of medicines list should be updated by daily basis to avoid any shortage of essential medicine or life-saving medicines. We have also daily sheet, humidity and temperature, including spirit sheet for cold chain. And the last one is cycle and physical count for pharma warehouse. Next slide, please. This photo from Al-Hasaka Pharma warehouse. After completing the inventory process, we are distribute this medicines to spirit storage areas according to the grants. Next slide, please. This is a reception area in Al-Hasaka Pharma warehouse. Next slide. This is also a reception area. It's also Al-Hasaka Pharma warehouse. This is quarantine area and expired items area. Next slide. This psychotropic drugs, it's also in spirit area, as you see. Next slide. This old prescription area, according to the IRC policy, we should to keep this old prescription between 4 to 5 years. Over to you, Nora.
Great, thank you. Omar, you seem to have, all these warehouses seem to be following all the good warehousing practices and so on, but tell me more about a specific example of a challenge in warehousing and storage that you have faced, and how and what practice did you implement to resolve it? Because this is, it seems to me that the SOPs are in place, that the staff implement those and follow those very closely. But tell us more about the challenges that you have been able to resolve by implementing these good practices.
Yes, Nora. What about challenges? We have three main challenges in Northeast Syria, actually. This is electricity, unavailable of general electricity, and also transportation, unavailability of cold chain or a special truck for transportation of medical commodities. And the last one, security situation. As you know, unstable security situation, security operations, especially in Al-Holkam, and also unsafe roads between governorates due to ongoing conflicts. What about electricity? Pharma warehouse was not availability of general electricity. The action was taken to be available generator, battery for cold chain, and also alternative generator. We have 2 generators and battery for cold chain. And we are monitoring warehouse during holidays. It's very important to monitoring of health communities during holidays and non-working hours. So we have a special monitoring device in the guard room with a list of emergency numbers. The guard are trained to read and report temperatures and inform when the temperature and humidity are out of the required range. As you see, we have 2 colors, green and blue. Green colors, it's a guard room temperature and humidity, and blue color, it's cold chain system, humidity and temperature. Next slide, please. What about health facilities and camps? We are keeping enough stock for 1 month, except life-saving medicines. As I mentioned before, in the list, we have tracer list. Distribution of medicines to clients to cover 1 week, especially in the summertime. The pharma team advised the patient to dig a small hole in the ground for cold chain medicines like insulin, a depth of 20 to 30 centimeters to keep it under stable temperature at least. Adjust generator working hours according to the weather conditions. Next slide, please. What about cold chain truck was not available the last time, so we contracted with the cold chain truck with the needed conditions and the monitoring through log tag device. Transport shipments cross borders was a problem with this step also, so we have pharma warehouse close to the border. Since to cross to the border will take a long of time between the border and the other pharma warehouses also. Cold chain truck cold chain truck from KRI or Kurdistan region, Iraq, are not allowed to cross to Nest. So we move the shipment to another one on Nest side. Then local health authorities, LHA takes sample to check. Action was taken, as I mentioned. We have a pharma warehouse close to the border with good capacity and with contingency stock to face any disruption. Next slide, please. Health facilities in the camps, availability of communities during any security issue. The action was taken to distribute medicines across 3 pharma warehouses. We have 3 pharma warehouses in 2 governorates to ensure access from any of these sites, if needed, access to any of the warehouses. For camps and health centers with unstable security, like Al-Hol camp, we distribute medicines on a weekly basis to avoid any losses and ensure availability. Over to you, Nora.
Thank you, Omar. And you were saying that the main challenges are electricity, transportation, and security situation. And some of the participants are saying that they are facing the same challenges. So I'm sure they find your actions very useful. Can you please provide, based on this experience and what you're doing in Syria, can you please provide some takeaway messages for organizations on the ground to secure warehousing conditions in the most dire situations? We know that the recent earthquake between Turkey and Syria recently demanded a lot of work from the Humanitarian Assistance organizations. So if you can share some takeaway messages.
Yes, Nora. Actually, it's very important to, first one, it's very important to monitor storage conditions outside of working hours and the holidays, as I mentioned before. And we have modified and adapted cold chain SOPs. We have cold chain emergency plan response, identify alternative storage facilities with backup power, ensure availability of appropriate packing containers, ice bag, vaccine carrier, identify who to call in case of an emergency, train its staff to manage cold chain packing and transportation, a clear and written plan to inform facilities, camps of the transportation and distribution of medicines to secure good storage conditions at the destination, the last one, as I mentioned before, availability of committee, it's very important from the beginning of preparing a process, ordering process, to follow up on the process of ordering, receiving, and releasing health communities. Over to you, Nora.
Thank you, Omar. And there are a lot of questions that we hope we will be able to respond at the end of this webinar. So thank you so much for sharing your experience in Syria, Omar. So now we will have Isaiah Nyamosi to share a very interesting topic about warehouse self-assessments, how they are part of the quality assurance best practices that IRC is implementing not only in Kenya, but globally. But before we start, Isaiah, can you please give us a brief introduction to IRC's work in Kenya, please?
Thank you, Nora, for the opportunity. Yeah, so basically, the IRC Kenya program operates in various regions within the country, mainly in the camp sites, that is in the northeastern part as well as the northwestern part of Kenya, as well as the urban refugee programs that operate within the Nairobi capital city of the country. Next. So basically, the IRC has been providing life-saving services to refugees and vulnerable communities in Kenya since the 1992. And currently, the IRC works in a multitude of capacities and locations to meet critical needs throughout the country, including one, the emergency response, where the IRC works in Garissa and Turkana counties to respond to drought emergencies and cholera outbreaks to support country-level government response. Refugee camp services also, where the IRC operates in 2 refugee camps, that's in Agadera, in the Dadaab complex, in Eastern Kenya, as well as in Kakuma in Northwest Kenya, and urban programming, where IRC provides livelihood programming for urban refugees and vulnerable Kenyan communities in the formal settlements of Nairobi. So the IRC in Kenya is also committed to forming strong partnerships with local and international organizations within both the private and public sector to ensure best practices and protection principles are deeply integrated for all programs. Next. So the background information for this particular subject, the quality assurance policy is essentially based on the WHO norms and the standards as defined in the WHO technical report series. So the IRC is committed to ensuring sustainable access to pharmaceutical products and medical devices of appropriate quality, safety, and efficacy for all its beneficiaries. And we are committed to sourcing, procuring, storing, distributing quality approved medicines to all our global health programs. And therefore, the quality assurance system covers the entire activity, that is supply chain, from raw materials to the final beneficiaries.
Great, thank you, Isaiah. And I noticed that you mentioned that you have a close relationship and partnership with private sector to ensure that the innovations in good practices are in place. So in your experience and given the topic that you're going to share with us today, why are warehouse self-assessments so important?
Thank you, Nora. So why warehouse self-assessment is important is because it's part of IRC's continued quality monitoring and improvement in all aspects of pharmaceutical quality management. And this practice also measures the level of compliance with WHO good storage and distribution practices within our supply chain for pharmaceuticals. And it provides data required for generation of corrective action and preventive action plans for improvement. And it's also a quality assurance practice. And also this is actually conducted once every year within our country programs, as well as in the global IRC operating sites. Next slide. So I will also explain what is warehouse self-assessment. Basically, it is a step-by-step process conducted internally to measure IRC's compliance with WHO good storage and distribution practices within the entire supply chain. It entails a thorough look at all aspects of premises where storage of pharmaceuticals happens, the personnel level, the processes that goes along, and equipment used to support pharmaceutical quality storage and distribution, and other best practices. So I will then, the next slide, Nora. Next slide.
Nabela?
Thank you. So what's the criteria then that we use while conducting this warehouse assessment? So first, we consider the persons responsible. This is mostly the country pharmacy manager takes leadership of this process, where he prepares the report, including the CAPA, that is the corrective action plan and the preventive action plan. The field pharmacist conducts the assessment with the warehouse officer or the warehouse manager. And now the senior manager pharmaceutical quality assurance, who sits at the head office, HQ, reviews the report and grades the findings and shares the final report where CAPA are provided, indicating the areas of improvement. And then the country pharmacist will get this feedback and they will communicate the findings with the management in country and he will also oversee the CAPA implementation plan. So what tools do we use during this process? One, we have a checklist with questions which guide us to explore all the areas along the supply chain. And we also use cameras to record and take photos of the premises where storage takes place for pharmaceuticals. So the process begins with orientation of the conducting team, where we take the team through the whole process. And then after this, of course, we now go to collect data, where also photos are taken. Then from this time, and then we also prepare now the CAPA, that is the corrective action and the preventive action plan. We share this CAPA and findings with the quality assurance manager, pharmaceuticals, who reviews the same and shares feedback back to us. And finally, now we begin the implementation and the monitoring of the CAPA process. Next slide. So we have got a number of terms that are used in grading the findings, and I will elaborate on them. So the first one is the essential or best practice. This basically means, and it's based on GDB standards within a GDB area where the core requirements are typically classified and as essential. So an example of this is that storage areas are of sufficient capacity to allow proper storage of the various categories of products. However, it's best practice to store items per category and alphabetically. So the IRC standard here is essential requirements that is not implemented. So in this case, we classify this as critical. Any essential requirement that is not implemented, we classify this as critical, a critical gap. So in terms of technical divination, a critical gap is any departure from guidelines on good distribution practice that results in a medical product causing a significant risk to the patient and the public as well. And this includes an activity in increasing the risk of falsified and substandard medicines reaching the patients. So an example in this case is storage of products requiring refrigeration at ambient temperatures. You realize that this is quite a big risk. So that will compromise the quality of cold chain products. And then the other example is rejected or recalled products are still found within regular stock, or else there is no fire control equipment or no temperature recording devices within the warehouse. This is referred to be a critical gap. Next. And then we have a major gap. IRC standard defines this as essential requirement that is not fully implemented or a best practice requirement that is not implemented. And in terms of the WHO technical definition of the same, a major gap is an uncritical deficiency, which indicates a major deviation from good distribution practice that adversely influences the product quality but does not have an influence on the patient's health. So an example of this is a leaking AC or outdated monitoring device, staff not fully trained, or no regular pest control within the warehouse, as well as having inadequate lighting within the warehouse. This is classified as a major deviation from the standard practice. Then we have also minor gaps or deviations, and IRC defines this as a best practice requirement that is not implemented, and WHO, the technical definition of the same, is actually a deviation which cannot be classified as either critical or major, but which indicates a departure from guidelines on good distribution practices. So an example in this case will be a case where we don't have a warehouse register within the warehouse, and then the warehouse documents are not organized within files in the chronological order. And then, of course, if we have the delivery schedule and routine planning missing within this supply chain operation. Next.
Yeah, thank you, Isaiah. So some people were asking what CAPA means. If you can remind us what it means.
Yes, CAPA basically is an abbreviated word which stands for corrective action, that's CA. PA stands for Preventative Action Plan. So you realize that when we are doing this warehouse assessment, our intention is to measure the compliance within our practices against recommended best practices by WHO. So once we get any deviation, then we are supposed to come up with a corrective action plan to correct the gaps that are available, and then also put a plan in place to prevent the same gaps from occurring. So that's what we call CAPA.
Okay, great. And so it seems that these grading terms that you have defined, Isaiah, where you have the essential, the practice, and then you know how you classify between major and minor standards is seems to be very practical and useful. So can you give us 3 takeaway messages for organizations on the ground on how to secure good warehousing conditions, and how, if this methodology can be implemented by anyone who wants to improve warehousing conditions?
Yeah, this methodology can be acquired or adopted in other places. Like in IRC, we actually have adapted this practice across all the IRC operating sites. So mainly the takeaway messages that I can put in place, one is under the storage of pharmaceuticals. We need to do monitoring and control for both humidity and temperature to avoid exposure of pharmaceuticals to harsh environmental conditions. And of course, we need to control pests and rodents within the storage area. Updating all the inventory records and the transactions within 24 hours of their occurrence. And then carry out regular inventory spot checks within the warehouses. Carry out warehouse self-assessment at least once every year and formulate the CAPA and monitor the implementation process. Under security, of course, we need to control access to the drugstore. We need to ensure that the doors are of burglary proof and the warehouse is having a double door that is lockable. Then, of course, we need to make sure that we implement the use of the warehouse register to ensure that we know who comes in and who gets out of the warehouse. Next. The other part is under personnel. Of course, we recognize the fact that the pharmacist should provide the technical support to existing warehouse staff who are not necessarily pharmacists or pharmacy staff, especially on proper management of pharmaceuticals. And we need to ensure that there is regular training for all staff that are handling pharmaceuticals, which is very critical to ensure that the output or the practices that we are talking about are adhered to. Under premises and equipment, of course, the store premises should be at least of fair general condition, and the cold chain storage should be well maintained and serviced at least once every quarter to ensure that there is no gap within the cold chain system. And then, of course, we need to have contingency plans, especially for power, where I would recommend that solar energy should be in place to provide alternate power to maintain cold chain storage during the power outages. I think that is what I can provide as takeaway points. And as I said earlier, the issue or the practice of self-warehouse assessment is something that can be adopted. As you can see, this is something that helps us to keep checking whether we are keeping in line with the recommended best practices of storage for pharmaceuticals. And of course, this one, if implemented, it helps you to keep improving from one level to another to ensure that you maintain the quality of pharmaceuticals from back to end.
Great.
Thank you, Nora.
Yeah, thank you, Isaiah. We have a lot of questions, and I just want to mention that both of you, Isaiah and Omar, mentioned inventory management, mentioned security, mentioned the importance of having trained staff to manage the supplies and not to underestimate the need to keep the training of staff up to date so that they can continue improving their warehousing practices. So we have a lot of questions, and I'll start with Omar. Someone is asking do you collaborate with other organizations to optimize logistics or pool distribution to ease the fleet management? Because you mentioned that you have limited storage space in some places. So do you collaborate with other organizations in ensuring enough warehousing space?
Thank you, Nora. About pharma warehouse in Raqqa, you mentioned with the limited capacity, because in this area, especially in this area, we have unstable security. So to avoid any losses, any kind of these challenges, we keep enough medicines for 3 months, except life-saving medicines. This is essential medicines, as I mentioned before. Tracer list, we have tracer list. So we keep the medicines enough for 3 months. We have cold chain track. We can to provide anytime if there are any needs. Thank you, Nora.
Thank you, Omar. So for you, Isaiah, how long will a typical self-assessment take? Like, the preparation, the team formation, the training, the actual assessment, and the grading. Is this automated or do you do it manually? And how long would that take?
Okay, thank you, Nora. I think I can answer that question. Well, now the self-warehouse assessment exercise is quite involving because it's being handled by a number of people within the program and supply chain. And it begins by us agreeing on the date. Of course, this is like a calendar activity that is done. For example, in the Kenya program, we do it once every August. The month of August is actually the time when we do it, but the duration usually takes around 4 weeks. You realize that the field warehouses will conduct this activity using the questionnaires that we have prepared, and do fill the whole a number of questions, which is actually around almost 30 also questions cutting across every department or section of warehousing. And then, of course, now bring the forms back where I also prepare the report. Once I do the report, I share it with the good assurance manager who is at the HQ. So the whole process is actually taking 4 weeks until we get the feedback.
Great. And a related question, who are actually involved in the spot checks or when they go and visit the warehouse or when they do the self-assessment?
Okay. So basically we must have the pharmacist on the ground. The pharmacist will lead the process, and we will have the warehouse manager, who is a supply chain person. And then the health manager can join or whoever else, but we must at least have people represent the warehouse and the technical person who is a pharmacist. So this team go through the questionnaire, moving around the store and taking the information that we require. And then now the country pharmacist, of course, now will get this data and the process and go through the whole checklist. Then it prepares now the CAPA report. Then the CAPA report, of course, will have various sections indicating what was the findings, what's the proposed way of managing it, who is going to be involved, are the resources required for this process, which time are we going to start the process? By what time will we have finished this, implementing this particular gap or recommendation? And then we share this to the QA manager, who will again go through, do now the grading, allocate, which is, of course, we do the allocation ourselves, say this is a minor gap, this is a major gap, or otherwise a critical gap. Then, of course, it will go through it, review the criteria of grading this, and it gives us feedback.
Okay, great. Thank you, Isaiah. You know, Omar, you mentioned security issues and how you have to deal with those. How do you handle supplies, the distribution of supplies, of the movement of supplies in those situations where there are conflicts near these warehouses that you have strategically located in the northeast region of Syria?
Yes, Nora. As I mentioned before, we have 3 pharma warehouses with good capacity, especially Al Hasaka Pharma Warehouse. This is central location for all regions, so we can to provide all health facilities. For example, Deir ez-Zor, when we have any security issue between Al-Raqqa and Deir ez-Zor governorate, we can to provide them from Al Hasaka Pharma Warehouse, and also from Derik. We have, as I mentioned, we have contingency stock. So this stock, we can to move it according to the needs. This is under IRC like service. We can to move it without any challenges related to donors, different donors. So we can to provide all health facilities because we have different donors in Northeast Syria. ECHO, GFFO, and other donors. So our pharma warehouses distributed according to the regions, according to be across the border, to have contingency stock, to have access. Any health facilities can to access to maybe there are any challenges, any unsafe roads, so we can to move from different pharma warehouses to support these health facilities.
Yes. Thank you. And there's a related question when you talked about, the lack of electricity that could affect the cold chain, especially. But also, what do you do when the stock of the warehouse in those facilities that you show but especially in disaster areas are not up to good standards? What do you do with that? What do you do to ensure that the warehouses comply with good practices?
During health disaster, you mean?
Yes, in disaster areas especially. Sometimes you don't have, like you show the good warehousing conditions in those pictures that you had in your presentation, but in the disaster areas, what do you do when the stock is not in good conditions?
During this time, Nora, we keep medicines for 1 week. For example, as I mentioned, for Al-Hol camp, we have unstable security situation. This is very dangerous to keep a lot of medicines in Al-Hol camp. So we provide the needs bi-weekly basis. We have a cold chain truck. We can to provide anytime. So we keep medicines for 1 week. This to avoid many challenges, not just security. Maybe there are electricity, as I mentioned. So we keep medicines for 1 week to avoid any kind of losses or any challenges related to that.
Yeah, thank you so much. Omar, we have many more questions, but we will share those with Omar and Isaiah to help us respond to those questions, and we will share them with the participants after the webinar. We want to take the opportunity to give some ideas for actions when you're thinking about ensuring good warehousing practices. And one of the things that both Omar and Ali and Isaiah mentioned are that the need to have SOPs, do job aids, and do warehousing assessments at least once a year. Also include all the warehouses costs in budgets to ensure that you have enough budget to make improvements to the warehouse and to be able to train staff as well. Also to have a comprehensive and permanent cold chain and temperature monitoring processes in place. Like Omar mentioned, even the guards should be trained in how to monitor temperature and when to report when there's a variation on the temperature ranges. Also to do the self-assessment of the warehouse self-assessments and have the trained people to do that. And also to keep people motivated to provide feedback and recognition for the work that they do, especially when they are following all the good practices in warehousing, and also to provide supportive supervision and also provide the tools they need to perform their job. We also wanted to share some resources that you can look at after once we send you these presentations, so that you can learn more about good warehousing practices and experiences. And I'm sure that you will have the opportunity also to exchange resources among yourselves. And so please do that whenever you can. So this is the end of our presentations. Thank you, Omar, for sharing your experience. Thank you, Isaiah, also for sharing what you're doing in Kenya and at the global level. Thank you to my colleagues, Annabella, Daniel, Garmit, for supporting and helping conduct this webinar and this technical discussion. And thank you all for joining us today, and we will get back to you soon. There are 2 people who have raised their hands. So if you can open up your mics and go ahead, you are more than welcome. Okay, I think it was Hamidullah, you want to say something? Okay, I think he was just, this person was just saying hello. Yes, saying hello. So thank you so much and see you next time.
See you guys. Take care. Thank you, Omar and Isaiah.
Thank you everyone. Thank you, Annabella and Nora.
Thank you,
Thank you.
Nora. Thank you, Annabella. See you next time.
Thank you. See you next time.